When would the Accutane purge begin after I start my treatment with Accutane? That's the question we're going to talk about today. Welcome, I'm Dr. Arthur Colsky, founder and medical director of Advanced Acne Institute, and we're a dermatology practice that treats only acne. So we like to offer our insights to acne sufferers who are focusing on the path toward clear skin. And we hope you find it useful, and keep in mind that this is only for educational value. This is not medical advice. So when would you expect to see evidence of an Accutane purge after starting Accutane treatment? So that's a question that often comes up. And the answer is that typically, we begin to see evidence of worsening of acne, if it's going to occur, within the first week or 2 weeks or month when we start Accutane. So usually by the first week or two, we begin to see the accumulation of additional pimples. And sometimes it can be just a few extra pimples, and sometimes it can even be worse than that, with cysts and nodules developing. And sometimes it doesn't even happen in the first month. It might start in the second month. And another time that we have to watch for that more closely is if we increase the dose of Accutane. So every time we increase the dose of Accutane during a course of Accutane treatment, we always want to be on the lookout to see if that patient is going to develop worsening of the acne or any other side effects that might occur with a higher dose of treatment. So typically we're most watchful during the first month, the first few weeks of treatment, because that's when we often see evidence of worsening. And I tell my patients always to be on the lookout for that, watch for any additional pimples and let me know right away, because I don't want them to get worse if I can help it. I want to be able to intervene and take some steps to try to stop that if it happens. Thankfully, the majority of patients do not experience worsening of their acne with Accutane. It's only a smaller percentage that do. But for that smaller percentage, we like to be very vigilant. We like to watch them closely. We like to have every patient involved in their own treatment so that they can bring that to my attention. We like to see patients early on in the treatment, within 10 days or so. We like to look and see if their acne is getting worse, because we want to be able to get in front of the problem rather than wait until it's already become a very big problem with a large cystic breakout, because that can be more challenging and more difficult to control. So the answer is that we're always watchful in the beginning of treatment, because that's typically when we see it, although it could happen actually at any time. Sometimes we see patients who begin to have worsening of their acne later on in their treatment, but that's not too common. So we're always on the lookout. We're always watchful. We're always assessing our patients' circumstances and their status during treatment with Accutane. And it's important that you keep your doctor informed about that as well, because your doctor can't watch you all the time, whereas you know exactly what's happening at any given time. And you need to be part of your treatment. You need to take a role in your treatment for things such as this, to help make your treatment a safe and effective one.